Clinical examination findings and electrolyte abnormalities of dogs with marijuana tetrahydrocannabinol toxicity. 223 cases, January 2017, July 2021. Introduction. The article explores the toxicity of cannabis sativa marijuana in dogs, with a focus on tetrahydrocannabinol THC, the psychoactive component responsible for marijuana's neurological effects. As marijuana becomes more legally accessible, cases of THC toxicity in dogs have increased. The study specifically examines the clinical signs, vital parameters, and electrolyte abnormalities in dogs diagnosed with THC toxicity, aiming to improve diagnosis and treatment in veterinary medicine. The research focuses on dogs that presented with THC ingestion or a positive human urine multi-drug test, HUMT, for THC metabolites. A retrospective analysis of 223 cases over a period from January 2017 to July 2021 was conducted. The goal is to describe the clinical manifestations and laboratory findings in dogs with THC toxicity, a growing concern due to the widespread availability of marijuana and marijuana-infused products. Tetrahydrocannabinol THC, a cannabinoid, binds to CB1 receptors in the brain and nervous system, producing neurological and systemic effects. Its metabolism in dogs differs from that in humans, with a lower excretion of THC metabolites in canine urine, which complicates the use of HUMTs as a diagnostic tool in veterinary medicine. Materials and methods. A total of 223 dogs were included in this retrospective study. Each dog presented with either a confirmed ingestion of THC-containing products or a positive result from a HUMT for THC metabolites. The following aspects of each case were documented: signalment, breed, age, and sex of the dogs. History, the type of THC exposure, whether owners admitted to marijuana being present in the household, and the clinical signs preceding presentation to the veterinary clinic. Clinical signs. A detailed description of neurological and systemic signs such as ataxia, hyperesthesia, lethargy, and urinary incontinence. Vital parameters. This includes heart rate, respiratory rate, body temperature, and blood pressure. Laboratory findings, blood gas analysis, complete blood count, CBC, serum chemistry profiles, and electrolyte imbalances such as hyperkalemia and hypercalcemia were recorded. Treatment and outcome. Supportive care measures such as fluid therapy, antiemetics, and hospitalization were noted. The survival rate was also tracked. The study used human urine multi-drug tests, HUMTs, to detect THC metabolites in dogs. HUMTs, however, are known to be less reliable in dogs due to lower levels of THC metabolites in canine urine compared to human urine. The gold standard for confirming THC toxicity remains gas chromatography mass spectrometry, but this is costly and not widely available in emergency settings. Statistical analysis was performed to assess the significance of various clinical signs and laboratory findings. The normality of data was assessed, and the appropriate statistical tests were employed to compare categorical and continuous variables. Results. The findings from the 223 cases shed light on the typical presentation and outcomes of marijuana toxicity in dogs. Signalment. Age. The median age of the dogs was 1 year, with a range of 1 month to 12 years. Younger dogs were more frequently affected. Sex. The cohort included spayed females, 23.3%, intact females, 16.1%, neutered males, 26%, and intact males, 34.5%. Breed. The most commonly affected breeds were mixed breed dogs, pit bull type dogs, German shepherds, huskies, and Labrador retrievers. Small breeds, including Chihuahuas and Yorkshire Terriers, were also represented. History. Exposure. THC exposure was typically accidental. 68% of owners denied the possibility of marijuana exposure in their household, while 32% admitted that marijuana was accessible. Many dogs developed symptoms after being outside or after visitors had been in the home. Common owner reports. Owners frequently describe their dogs as acting abnormal or exhibiting neurologic signs after going outside, visiting a public place, or interacting with guests. Clinical signs. Ataxia. 88.3% of the dogs exhibited ataxia, a loss of coordination, which is one of the most consistent signs of THC toxicity. Hyperesthesia. 75.3% showed signs of hyperesthesia, or increased sensitivity to touch, particularly around the head and neck. Urinary incontinence. 45.7% of dogs were unable to control urination, a common neurologic side effect of THC. Lethargy. 62.8% presented with lethargy or depressed mentation. Vomiting. 26% experienced vomiting. Other notable clinical findings included tremors, mydriasis, dilated pupils, and generalized weakness. Dogs often appeared anxious, agitated, or disoriented. Some exhibited abnormal gait, falling over, or leaning to one side, further suggesting vestibular dysfunction. Vitals. The dog's vital signs were mostly within normal ranges, but some notable abnormalities were recorded. Heart rate, tachycardia, 37%, was more common than bradycardia, 5%. Most dogs presented with a normal heart rate, 58%. Respiratory rate. The vast majority of dogs, 81.5%, had a normal respiratory rate. Body temperature. 22.6% of the dogs were hyperthermic fever while 16% were hypothermic, below normal body temperature. Blood pressure. 60.7% of the dogs were hypertensive, elevated blood pressure, with a median systolic pressure of 150 mm Hg. Laboratory findings. Electrolyte imbalances, hyperkalemia, Elevated potassium was observed in 51.3% of the dogs, with most cases being mild, 4.8 to 5.7 mg. Ionized hypercalcemia, elevated calcium, was present in 79.1% of the dogs, which is notable since hypercalcemia is not commonly associated with THC toxicity in humans. The ionized hypercalcemia in these dogs was predominantly mild, but the findings suggest a potential effect of THC on calcium regulation in dogs, mediated by cannabinoid receptors. Venous blood gas. Blood gas analysis revealed that 37.3% of the dogs were hypercapnic, elevated CO2 levels, suggesting hypoventilation, which is consistent with the sedative effects of THC. Treatment and outcome. Most dogs recovered with supportive care, and the overall prognosis for dogs with THC toxicity was excellent. 57.8% of dogs received no specific treatment, as the clinical signs resolved on their own. Supportive care. 23.8% of dogs received subcutaneous fluids, and 18.4% were given antiemetics to prevent vomiting. Hospitalization. Only 9.86% of the dogs required hospitalization, with the median stay being 24 hours. All hospitalized dogs were discharged successfully. More intensive treatments, such as IV fluids, lipid therapy, and gastric lavage, were rarely required. There were no fatalities, and 100% of the dogs survived. Discussion. The discussion focuses on the clinical relevance of the findings and the implications for veterinary practice. Clinical presentation. The most common combination of clinical signs, ataxia, hyperesthesia, and urinary incontinence, was seen in many dogs with THC toxicity. These signs are neurologic in nature and reflect the action of THC on the CB1 receptors in the brain, which modulate motor control, sensory perception, and autonomic functions. Electrolyte abnormalities. The unexpected findings of hyperkalemia and ionized hypercalcemia suggest that THC may influence potassium and calcium regulation in dogs. These electrolyte abnormalities, while mild, may provide additional diagnostic clues in cases where marijuana exposure is suspected but not confirmed. The CB1 receptors, which THC binds to, are involved in various metabolic processes, including potassium and calcium homeostasis. The study's finding that nearly half of the dogs exhibited hyperkalemia suggests that cannabinoid receptor activation could be disrupting potassium channels in the kidneys or muscle tissues. Comparison to human findings. In contrast to dogs, humans with THC toxicity are more likely to experience hypokalemia, low potassium levels. This discrepancy highlights the species-specific effects of cannabinoids and suggests that the pathophysiology of THC toxicity in dogs may differ from that in humans. The GPR55 receptor, which has opposite effects to CB1 receptors, could be involved in the development of hyperkalemia in dogs. Limitations. The study's retrospective design limits its ability to control for variables such as the amount and type of THC exposure. Furthermore, the HUMT used to confirm THC exposure in dogs has limited sensitivity and specificity, as dogs excrete far lower amounts of THC metabolites in their urine than humans. Conclusion. The study provides valuable insights into the clinical signs and laboratory findings associated with THC toxicity in dogs. The combination of ataxia, hyperesthesia, and urinary incontinence should raise suspicion for THC toxicity, especially in younger dogs or dogs with a history of exposure to marijuana. Additionally, mild hyperkalemia and ionized hypercalcemia may serve as useful diagnostic indicators, although further research is needed to confirm these findings in larger populations.